everybody. I will be talking about um, a 75-year-old patient that I saw who came in for decreased hearing on his left side and symptoms of dizziness and vertigo. Okay, so for this appointment, he had two things. First was an audio, and then the second was a VNG. So my preceptor did his audio, and then I did his VNG. So from the audio, his case history, he talked about his hearing loss, mentioned that he had this decrease on his left side, and also started having this dizziness and vertigo. Um, that all of this occurred in October of 2022 of last year. Um, Another thing that he mentioned is that he had a bilateral stapedectomy around 1983. Okay, and then he also was reporting oral fullness on that left side as well. So after case history, she got into testing, and from pure tones, she found that in the right ear, he was normal, sloping to severe, and it was sensory neural. This wasn't something that was concerning us because it's basically what we would expect um, with his age and his noise exposure history. And also, just he wasn't complaining about the right ear; it was his left ear. So when we tested his left ear, or when my preceptor tested his left ear with pure tones, she found that he had moderate, sloping to profound mixed hearing loss, and there's some pretty big air bone gaps in here too. Now with speech testing, in the right ear she had 15, in the left ear she had 40. Sorry, he had 45. With word recognition, he scored 80% in the right and 64% in the left. Now, with tympanometry, we start with tympanometry, but it's just mentioned later in the report. But with TIMPs, she wasn't able to obtain a seal on that right side, which we weren't really concerned about the right side, so not a big deal. But when she was able to get a seal on the left side, and when she tested that side, she got normal volume, normal pressure, but abnormal compliance. The compliance was 3.46, so we have a hypermobile TM right here. And that's all the audio information I'm going to give you there. So now, moving into the VNG. So case history, he said that he had these symptoms of dizziness and vertigo that first occurred in October of 2022. Now, his symptoms are mainly episodic. So his first episode occurred in October, and with this episode, he had an onset of vertigo, oral fullness of the left ear, which was accompanied by vomiting too, and the hearing loss as well. Now, since this was such a intense episode that he was having, he was taken to the ER, and at the ER they gave him meclizine and I think dramamine too, just something to temporarily suppress everything and calm him down. And he did get better after that, but then he had 2 more episodes after that. Now, second episode, he did not have vertigo, but he did have dizziness that did last for hours. No vomiting, but he was nauseous, and he also still had that fullness in the left ear. And with the fullness, he said that he had this waterfall type sound as well. And that's all the information for the case history that I'm going to give you. So moving into the actual tests, almost everything was normal in his VNG. V-hit, normal. Ocular tilt, normal. Gaze, normal. Hall pipe, positional, ocular motors. Everything was normal, but then we got to calorics. Now with calorics, I only did warm because our irrigator was having some issues, wasn't able to do cold, but I was able to get it to do warm. So I got that on the patient, and with that, I got a unilateral weakness on the left side. That's what it showed, okay? Now that is all the audio information, all the vestibular information I'm going to give for this patient. Now, all there is for you guys to do is just figure out, what were the next steps? What was our referral? What were the outcomes? And I will get back to you on that soon. Take care.